Hello everyone, welcome to my YouTube channel. I'm going to be presenting another question that is associated with American Society for Clinical Pathology exam. And please do note that the information I'm going to be providing here is not limited to this particular exam. It can also be beneficial if you are preparing for any kind of interview in hematology, okay? Whether it is here in the UK or maybe Canada, Australia, or any part of the world, including Africa, Asia, as the case may be, okay? All right, let's move into that. So I'm going to be trying to present something that has to do with blood film morphology or blood smear morphology, depending on what you know it to be. So my name is Dr. Emmanuel Elodo. I'm a biomedical scientist and I'm also a lecturer in biomedical science here in the United Kingdom. So let's see the question here, okay? Right, so look at this question. They've asked a question and say, which of the following cell types is characterized of megaloblastic anemia? Which of the following cell types is characterized of megaloblastic anemia? So they gave, is it target cells? Is it acanthocyte? Is it hypersegmented neutrophils? Is it spherocyte? Okay. Now, what I'm going to say, I already have video on megaloblastic anemia. In fact, I have video on blood film morphology, which I'm going to recommend that you should actually go and listen to it. I'll try to also tag it up with this video. Okay. So look forward for it. But first of all, I want you to know that this is megaloblastic anemia. So first of all, let's say that anemia, like I had mentioned as well on my previous video, can be either normocytic anemia, it could be either microcytic anemia, or it could be either macrocytic anemia. Okay. Now, megaloblastic anemia is actually under macrocytic anemia, okay? That is MA, okay? Macrocytic anemia. So because under macrocytic anemia, you can have megaloblastic and non-megaloblastic. I'd already explained this on my previous video, okay? Now, obviously, when we say megaloblastic, you are looking at maybe due to maybe vitamin B12 or folate deficiency, okay? Then, of course, if it is non-megaloblastic, maybe liver disease, kidney disease, as the case may be. So I'm just trying to highlight the point. So, but the question here is, they've given you this question. They say, okay, which of the following cell type is characterized of megaloblastic anemia? So for you to be able to understand this, you must know what the megaloblastic anemia is, which was why I mentioned that, okay? It's macrocytic anemia, okay? And it is due to maybe vitamin B12 or folate deficiency. So what do you think is commonly associated with megaloblastic anemia? Okay, now I will provide the answer for you, which is actually hypersegmented neutrophils. Okay, I had already said this on my previous video. Okay, so once somebody has macrocytic anemia, once somebody have macrocytic anemia, which megaloblastic anemia is one of them, what you're going to see is hypersegmented neutrophils. It is common, very, very common. Okay. Now, this other thing that is mentioned here may not. For example, in terms of target cells, even acanthocyte, okay, spherocyte, maybe you can see those things, maybe something like thalassemia, iron deficiency anemia, or maybe hemolytic anemia, as the case may be. So the one that is mainly common with megaloblastic anemia is hypersegmented neutrophils. What do I mean by hypersegmented neutrophils? You know that neutrophils are supposed to have like about 3 lobes, okay? 3 lobes, okay? Now, but when you now have a neutrophils having maybe more than 3 lobes, maybe 4, 5, 6, more lobes, okay? That then is called hypersegmented neutrophils. So hypersegmented neutrophils is commonly associated with megaloblastic anemia. Okay, so that is the answer. Megaloblastic. So the answer is hypersegmented neutrophils. So now it is important for us to now ask ourselves, what is a scientific, I try to provide a scientific reason why should the neutrophils now, instead of having 3 lobes, begin to have 4 lobes or 5 lobes or 6 lobes, as the case may be. The reason why the lobes is increasing is because of the DNA synthesis. So if there is a defect or delay in the DNA synthesis of the cell, that is what that causes that. So what happened then is that that was why I presented this, okay? What happened then is that you now see that the nucleus, will now mature slowly, okay? Remember that the lobus is like the nucleus, okay? So the nucleus will mature slowly, and that nucleus maturing slowly, not maturing the way it's supposed to mature, is taking time to mature, will now impair the DNA replicate, and that is why you now have more, lobus associated with that, due to this impaired DNA replicate, okay? They continue to replicate themselves due to that slow maturity process of the nucleus, okay? So that's what that leads to that, okay? Now, while that is low, however, what happens that the cytoplasm will just mature normally. So that neutrophils, while the cytoplasm is maturing normally, the nucleus is maturing very slowly, and that will cause an impaired DNA replicate, and that is why you have more than that 3 lobes. Okay, I hope that makes sense. But anyway, that's just for me to give you further information. But the interview question, that's sort of the examination, asks them what cell type can be associated with megaloblastic anemia, and like I've said, the answer is hypersegmented neutrophils. Okay, happy day. So that's the answer to the question. Okay, right. Now, just to see how much you would think about this again, I tried to see. Anyway, I don't actually highlighted it, so my thought now is somehow not right, because I shouldn't have highlighted the answer for you. Anyway, so I wanted to see if you understood what I've said by trying to give you another case, okay, where a 60-year-old woman presented with fatigue. Okay, remember, anytime somebody is anemic, fatigue is one of the things you are going to see, whether it is normocytic anemia, microcytic anemia, or macrocytic anemia, which you are going to see this megaloblastic. So fatigue is usually associated with anemia. Okay, let me continue. A 60-year-old woman present with fatigue. Her blood smear shows over macrocyte. That's what I'm trying to tell you, that megaloblastic anemia is macrocytosis. So you can see that it is over macrocyte. That means there is macrocyte. That means that the red cells are bigger inside than normal. Okay, and he said that the neutrophils is with what 6 to 7 what nuclear lobes. So I've given you the answer. Okay, which is hypersegmented neutrophils. Okay, what is the most likely cause? So that's indirect way of asking what I tried to say here. So is megaloblastic anemia. I shouldn't have highlighted it, but I've highlighted it anyway. It's just to make sure you actually understand what I've said. So this question here, I've asked it indirectly in this way. Okay, so what I've done was I've given you the hypersegmented as 6 to 7 nuclear lobes. Okay, and this megaloblastic, I've given it to you as macrocyte. Okay, because it is under macrocyte. Then and I gave you this megaloblastic as one of the options. So please do note that once you look at macrocyte, okay, that is a macrocytic anemia, which megaloblastic is underneath of it. Okay, so once it is megaloblastic anemia or macrocytic anemia, one of the things you are going to see is what? Hypersegmented neutrophils. And hypersegmented neutrophils means that the neutrophils has maybe more than 3 lobes, 5, 6, 7 lobes. Okay, as the case may be, that is hypersegmented. Okay, neutrophils. Okay, so that makes sense. So the answer to this question is megaloblastic anemia, which is also the same thing with this answer here. Just I asked it the other way around. Okay, I hope that makes sense. And I said that the reason why there is more lobes is because of as a result of DNA synthesis due to the slow maturity process of what nucleus, while the cytoplasm is maturing the way it's supposed to. I hope that makes sense. So please don't forget, hypersegmented neutrophils is associated with what? Macrocytic anemia, which megaloblastic is also there. So what if it is non-megaloblastic? Like I said, you are likely to also to see hypersegmented neutrophils. Remember, macrocytic anemia can be either megaloblastic and non-megaloblastic. But whichever way you look at it, whether megaloblastic, non-megaloblastic, or macrocytic anemia, okay, one of the things you are going to see is hypersegmented neutrophils. Please don't forget that. Okay, all right, I think that is the case. Okay, thank you so much for listening. Okay, if you let me know if you have any question and put it in the comment section, please. Can I ask you to like, share, subscribe, and comment? Please comment. Tell me what you think about the video. Okay, I want to see. I usually look at the people's comment. Tell me what you think about the video, and please try to subscribe. The effort in making the videos, one of the ways you can appreciate is to subscribe and to share the videos and comment. Okay. Anyway, thank you so much. Can I also further mention that you feel free to contact Too Good Consultant in any way you want us to support you, either because you are preparing for interview or exam, or you needed a kind of either academic or maybe career support. Whichever way, we are more than happy to help you. So feel free to contact Too Good Consultant Limited. Okay, all right, thank you so much, and I wish you all the best till I come back away again. Bye bye.